I'm going to raise. Okay, so you do 2 pillows on one side. Go ahead and lift your head up for me. Okay. You can rest your head down there. I'm going to go ahead and lower your bed, and I'm going to come around to the other side, and I'll put the other 2 pillows on. Because if I try to put the pillow from here, I'm not going to be able to use proper body mechanics. So then I'm going to lower the bed all the way. Okay, your bed's in the lowest position and locked. I'm going to come around to the other side. Now I'm going to raise the bed to a workable height again. Anytime you leave your patient, bed in the lowest position and locked. Then when you come back, the bed has to be at a workable height. Now, lower this rail. And I'm going to put a pillow between her legs. So let me bend your knee here. Go ahead and whatever is comfortable. You can do it that way. If you go this way, they're probably not going to stress too much on that. The main thing is that the knees aren't hitting each other and the ankles aren't hitting each other, applying pressure. Then your 4th pillow, because remember we're making a diamond. 4th pillow, sorry about that. We'll go under here like this.
With the wrist going down? See,
unless, now, if they have weakness on one side, remember you're going to have the elbow and all that higher, and you're going to put a mitt. But for this skill, they're not going to have that. They're just going to have you. Okay, this arm will go down here. Okay, are you comfortable? And then this go up. Okay, now none of this has to be exact. It's the main thing is that they're comfortable. What you do have to watch for is that they're not putting a lot of pressure on their hip. Because, okay, if she's laying with all her pressure on the hip, then this bone is pressing against the bed, and that will be very uncomfortable. So you want them to have a little bit of a tilt. And then this here, if they're like this, and they're putting all that pressure on the shoulder, then you can even just simulate. Okay, I'm just going to gently pull your shoulder out. There you go. Okay, because I don't want a lot of pressure on that shoulder. Just put this under there. Okay, how does that feel? Okay. All right. So, if this pillow's a little off or this pillow's a little off, they're not going to stress on that. Now, you guys don't do the supine position anymore. The supine position was the one where they used to have the right-sided weakness. So they were laying on their back, and they put a pillow under here, and then it had their elbow higher than their shoulder, and then their hand was higher, and then they put a washcloth roll in their hand. If for some reason they say that this patient, sorry about that, has left-sided weakness, then you'll put a, everybody knows how to make a roll?
Yes. No.
Okay, go ahead and get a washcloth for me, somebody.
And some good hand rolls in
Yeah.
that closet back there.
I'll show you that real quick.
Do we need to put a hand roll in on the
If they
side
have-
lateral?
No, unless they say the patient has a weakness, then we'll do that.
Do they do that?
What's that?
Like they always do.
Yeah. Because what they did with the last class is they altered the bed bath, and we were just talking about that outside. They said your patient has a rash on their chest. We did not go over that in class. I went over it when we were lecturing, but we didn't go over it during the skills. So she had to remember from the lecture what to do. And she was smart enough that she was. What would you guys do if a patient has a rash on their chest and you have to give them an upper body bed bath? What would change? No soap, that's right. Yes. Yeah. So you wouldn't use soap if they say they have a rash on their chest and abdomen. You would not use soap in that area. You would just use water, and that washcloth would only be used to clean that area. And remember, you're doing one half, so you would discard that washcloth. And then when you did the other half, you would discard that washcloth. You wouldn't use that washcloth for the arms or the neck or anything else, because then you could be spreading the rash.
Was the, oh, you don't know. I'm trying to ask her now. Was the,
I'm right here.
oh, there you are.
Printing stuff out for school.
Was the resident, did they already have their
Okay, you
bath
see how I
blanket
fold the
on top?
washcloth
Yeah, they were
in
residents.
half, and then we
So
roll
your
it?
bath blanket was on top, so.
And I'll make a couple of these for you guys for boards. and then I put a couple pieces of tape on there, and it just makes a roll, and then I'll put that in her hand. And that's mainly for patients that have contractures, so that way they're not digging their nails into the palm of their hand.
Is that the same as a foot roll?
No. A foot roll is when they're lying on their back. Go ahead, let me have you lay on your back. I'll show you guys what this is. Okay, because normally what they're talking about there, let's say that she had, that's her right side. She has right side of weakness. Okay, so then I'm going to put the pillow like this. See, so the elbows are slightly higher than the wrist, or the elbow is slightly higher than the shoulder, and then the wrist is slightly higher than the elbow, and then I'll put the hand roll there. A foot roll would be this. You can use a pillow, and that is mainly to prevent foot drop, because if they're bedridden for a long period of time, their tendons will get weak and their ligaments, and then their feet will drop. And it takes a long time for physical therapists to repair that. So it's a lot easier if they're bedridden for a long time is to make a foot support, and that way it keeps their feet up for them. The other thing that they'll do is if they're bedridden for a long time, the blankets and sheet will be pushing on their toes, and they can irritate them and cause skin breakdown and other things. So they'll put what's called a foot cradle. I don't know if any of you have seen those in clinicals yet. And they'll just put a cradle over here, and then the blanket and sheet will go over the cradle. Okay, thank you very much. You were a very good patient. I'm going to go ahead and set up the table with all the other skills materials, and you guys can practice whatever you want.